Hello, great doctors. Welcome to Doctor-led channel, Telegram and YouTube. First of all, I'd like to congratulate the doctors who have recently cleared the PLAB 1 exam and best of luck in the PLAB 2 exam and your whole career. So today we are arranging an orientation session about the PLAB 2 exam, and this is according to the GMC point of view. Okay, so let's start. So it's really important before we start to put this in your mind. Please do not say, I wish, and say, I will. Do not say, I wish, and say, I will. It's really important to have the passion to do things, but the more important thing is to take the steps to do the things yourself. Not lose hope. You are still able to do everything you can do in your dreams, but with some patience and working so hard. Okay. So it's really important to ask ourselves. One moment, just admitting some great doctors in our session. So, what is PLAB 2? PLAB 2 is an objective structured clinical exam. Objective structured clinical exam. This means that you are dealing with simulated patients all through your exam. Okay, so it is made up of 18 scenarios, 18 stations you should find in your exam. Actually, you have 20 stations. Out of 20, there are 18 stations, which are 18 scenarios, and you may find at least 2 rest stations. Each of the 18 stations or 18 scenarios are lasting for 8 minutes, just 8 minutes, and aims to reflect the real-life setting, including mock consultation or an acute ward. So it's really important to keep this in our minds. Each station will be for 8 minutes and will reflect a real-life setting. This means that you need to deal with the patient as if you are in a real-life scenario. You are dealing with a real patient in your life. You can find it in any of the wards, including the acute ward, the A&E department. Okay? Yes. So, what does the exam cover? What does the exam cover? The exam covers everything a UK-trained doctor might expect to see on the first day of Foundation Year 2, F2. You are an FY2 doctor. Okay? It is as if you are in the first day of the Foundation Year 2. You are dealing with the patients. They are seeing how you are dealing with those patients, as if in the real life situation, as you've mentioned earlier. It tests your ability to apply knowledge to the care of patients, not how well you can remember and recite facts. Your ability to apply knowledge, the knowledge you know, to the care of patients, not how well you can remember or recite facts. Okay, so please, really, really important to keep this in your mind. Do not just remember things and try to recite them in the exam, because this is actually not the real life situation. This is not how you deal with your patients. You need to deal naturally as you are a real doctor in a real life scenario. All the questions relate to current best practice. So you should answer them in relation to published evidence and not according to your local arrangements. Okay? You need to answer them. You need to answer the questions in relation to published evidence and not according to your local arrangements. You need, whenever you are talking to a patient, especially in a real life scenario, you need to talk according to guidelines and local arrangements, not from your own knowledge. Really important to follow the guidelines. Okay, so it's really important to know that the names of the drugs referred to in the exam are those contained in the most recent edition of the British National Formulary, which is a BNF. Here is the shape of the BNF. I don't know whether some of you doctors know about the BNF. BNF simply, it's like the drug index. The drug index you know about. This means that you need to always keep in your mind that whenever you are dealing with a patient, you need to double check. Whenever you are talking about medication, you need to double check with the BNF, because BNF contains any medication that you are talking about to your patient, how you are using this medication, and what are the side effects of those medications whenever you're talking to your patient. So you need to double check with your book, which is the BNF. Okay, so how do you answer the questions? The whole exam will take around 3 hours and 10 minutes. 3 hours and 10 minutes. You will have 1.5 minutes between scenarios, 1.5 minutes between each scenario to read the instructions and patient information. Before every scenario, before every station, you will have 1.5 minutes to read the instructions and patient information. Okay, then you will enter your cubicle to talk to your patient. There will be at least 2 rest stations allowing you to take breaks, such as like coffee break or biscuits or whatever you want. Okay, so the exam is usually divided into 2 main times, the early morning time and the afternoon time. Early morning time is around 8 o'clock, afternoon time is around 12 or 1 p.m. Okay, so the whole exam takes around 3 hours and 10 minutes with 2 rest stations. Okay, so the domains you will be marked against. So in the PLAB 2 exam, you do have 3 domains to be marked against, according to the GMC website. So you have 3 domains. The first domain is data gathering. Data gathering, technical and assessment skills. Data gathering, as simple as you are gaining information from your patient. Okay, so this information can include history taking, physical examination, practical procedures, investigations leading to a diagnosis. So data gathering, technical and assessment skills is the domain number one you are gonna mark it against, data gathering. The domain number two, clinical management skills. Clinical management skills. Clinical management skills include formulating a diagnosis, explaining something to the patient, formulating a management plan. Your management plan, you are managing the patient in which situation, in which shape you are managing your patient. It's really important to put this in your mind. The third domain is the interpersonal skills. Interpersonal skills are really important, doctors. Please keep this in your minds. Interpersonal skills, how you are approaching the station, how you are dealing with a patient, how you are building a rapport with your patient, how you use open and closed questions involving the patient and demonstrating your professionalism and understanding of ethical principles. Really important. This is how you deal with a patient, how you are building rapport with a patient, how you are respecting the patient, and really important to be patient-centered. This is a really important approach. The personal skills, you are gonna mark it against them in the exam. Every domain has 4 marks. So data gathering part, 4 marks, clinical management skills, 4 marks, and interpersonal skills, 4 marks. You are gonna mark it against them. So the total is 12 marks. So let's come across the clinical examination. Okay, so the clinical examination, the examiner will assess you on your ability to conduct a physical examination of a simulated patient. A simulated patient, this will be an actor who is trained to display signs when required. Again, the examiner will assess you on your ability to conduct a physical examination of a simulated patient. This is not a real patient, but he or she is a simulated patient. This will be an actor, a well-trained actor, to display signs when required. Okay. Where a station includes uncomfortable or intimate examinations, the GMC will use an anatomical model. For example, vaginal examination or doing like urinary catheterization or so. So the GMC will use an anatomical model. So they expect you to be able to carry out any basic physical examination. What are the examinations that you are expected to do in your exam? For example, abdominal examination, breast examination, chest, hand, heart, and joints. You must be able to perform a rectal or bimanual examination. You must also be able to use the appropriate equipment in carrying out an examination of the ear, the eye, and or the nervous system. Again, you need to know about abdominal examination, breast examination, chest examination, hand examination, heart and joints. And you must be able to perform rectal examination or bimanual vaginal examination. You must also be able to use appropriate equipment in carrying out an examination of the ear, the eye, or nervous system. You may be required as well to perform an examination or other procedure on a simulator. A simulator, it is called SimMan or SimWoman, which can be programmed to show normal and abnormal clinical signs. Normal and abnormal clinical signs. A role player may speak from outside the room using a microphone connected to the simulator. So this is a SimMan or a SimWoman. Okay, it is a simulator which can be programmed to show normal and abnormal clinical signs. A role player may speak from outside the room using a microphone connected to the simulator, and you need to know how to deal with this simulator or SimMan or SimWoman. Really important to know about that. Practical skills. The examiner will assess you on your ability to perform common practical procedures. The practical skills may include blood pressure measuring, venipuncture, inserting a cannula into a peripheral vein, calculating drug dosage, intravenous injections, mixing and injecting drugs into an intravenous bag. Again, you need to know how to, or I think that most of the doctors know how to check blood pressure, venipuncture, how to withdraw blood from your patient, inserting a cannula into a peripheral vein, so cannulation, calculating drug dosage, how to calculate drug dosage you are giving to your patient, intravenous injections, and mixing and injecting drugs into an intravenous bag. Okay? Okay. Another things you need to know how to do intramuscular and subcutaneous injections, basic cardiopulmonary resuscitation for adults and children, CPR, basic CPR for adults and children, suturing, interpreting an ECG, X-rays, or results of other investigations. Interpreting ECGs, X-rays, or results of other investigations. Interpreting basic respiratory function tests, performing urinary catheterization, taking a cervical smear, safe disposal of sharps. You need to know how to dispose of sharps safely in the safe box. So you need to know how to give IM or subcutaneous injections, basic CPR for adults and children, suturing, interpreting an ECG, X-rays, or results of other investigations. You need also to interpret basic respiratory function tests, perform urinary catheterization, taking a cervical smear, and safe disposal of sharps. Let's talk now about the interpersonal skills, how we are dealing with patient. It's really important. You are gonna mark it against your interpersonal skills. So the GMC tests interpersonal skills, or IPS, by observing the interaction between you and another person, how you interact with another person or a patient, usually a simulated patient or occasionally the examiner. The examiner will assess your approach to the patient all through the examination. All through the examination, you will be assessed how you are dealing with your patient. What is your interaction between you and the patient? It's really important to put this in your consideration. So this may include Explaining diagnosis. Explain, how do you explain diagnosis to the patient? Investigations and treatment. How you are asking or telling the patient that you need to run some tests, some investigations, and you need to tell the patient that you need to treat him or her, and how you are going to tell them so. You need to involve the patient in the decision making. Your patient is not a robot. Actually, he is a real human being. You need to ask them and take their decisions before doing anything that they must be involved in. How you communicate with relatives. Really important to know how to communicate with relatives, with a mother that is worried about her son, with a husband who is worried about his wife, etc. Need to know how to communicate with them. Breaking bad news is really important. How do you break bad news? How do you break them in layers? It's really important to know how to break bad news. You can face such difficult situations, so you need to know how to break bad news to patients, such as serious conditions. And seeking informed consent or clarification for an invasive procedure or obtaining consent for a post-mortem. Seeking consent. Consent is really important to seek informed consent for an invasive procedure or obtaining consent for a post-mortem. This is how you are dealing interpersonal skills. You can also deal with anxious patients or relatives, anxious patients or relatives, angry patients. You need to know how to deal with them. Those are included in the interpersonal skills. And also, you can give instructions on discharge from hospital. A patient who is being discharged now, how to give instructions on discharging from the hospital. Giving advice on lifestyle, health promotion, or risk factors. How to give advice on lifestyle, such as a patient who is a smoker. You need to give him or her some lifestyle advice in order to quit smoking if they wish to. As a promotion or some risk factors. How to give advice about all this stuff, really important to know about. Interpersonal skills also, you may use anatomical model in some stations, so it's important to remember the following. Please, doctors, do not speak to the model as you will not gain any marks for doing so. Please never speak to the model as you will not gain any marks for doing so, okay? You are not speaking to the model. Please tell the examiner what you are doing and why only if the instructions tell you to. Okay, so tell the examiner what you are doing and why only if the instructions tell you to. Okay, do not speak to the examiner unless about what you are doing, unless the instructions tell you to. Please do not perform any actions on an anatomical model that would be unsafe or painful to a real person. Again, you are trying to simulate a real life situation. So please do not perform any action on an anatomical model that would be unsafe or painful to a real person. Really important to keep this in your mind. So, where can you take the PLAB 2? You can take the PLAB 2 at the Clinical Assessment Center in Manchester, UK. In Manchester, UK, the Clinical Assessment Center. So, PLAB 2 test dates. The PLAB 2 test dates are run throughout the year. You can view available dates and book under the My Test section of the GMC online, and you can only do this once you cleared PLAB 1. Okay? Yes. So how do you book or cancel a place? So before you book a PLAB exam, you must have acceptable primary medical qualification, the necessary knowledge of English, TOT, for example, or the IELTS. If you haven't graduated yet, they will need to confirm that you have passed your final examinations and you are eligible for the qualification. So you need to have finished acceptable primary medical qualification and the necessary knowledge of English. But if you haven't graduated yet, they will need to confirm that you have passed your final examinations and are eligible for the qualification. So how much does the exam cost? It is £875 sterling from 1 April 2020 for the doctors who haven't still booked the exam. So cancellation fees. Okay, so you can cancel the examination if you have already booked it. So the period of notice is over 83 days before the exam, so there are no cancellation fees. Between 83 and 43 days before the exam, just 50% of the fee paid can be returned back. Less than 43 days before the exam, 100% of the fee paid. Less than 43 days before the exam, you cannot get any refund. Okay. So, are there any concessions for refugees? The doctors who are applying for the exam are refugees. If you are a refugee doctor living in the UK, the fee for part 2 will be reduced by 50% for your first 2 attempts. So if you are a refugee doctor who is living in the UK, the fee for part 2 will be reduced by 50% for your first 2 attempts. So let's get to an important part. What are the resources you need for the PLAB 2 exam? Okay, so you can find on the GMC website, and I will leave a copy of those links on the description box on the YouTube channel and the Telegram link. Okay, so there is something called the blueprint, the PLAB blueprint. The blueprint is a guide to what the exam covers and can help you to prepare. It sets out the knowledge, skills, and behaviors you are expected to demonstrate in the exam and beyond. So, all the topics and skills needed to pass are covered in the blueprint. Okay? Blueprint. I will leave a comment, I will leave a link of this blueprint, so do not worry about it. The foundation program curriculum. All the topics and skill areas covered by the PLAB blueprint match those typically faced by doctors starting the second year of their UK Foundation Program training, the FY2. So this is how we make sure doctors who pass the PLAB test are at the same level as UK qualified doctors. So you will find this curriculum in the comments as well, don't worry. Okay, so courses. Okay, so you don't need to attend a study or coaching course to pass, but many candidates choose to do so. The GMC doesn't offer courses and they do not endorse or monitor the quality of courses given by others. So courses, you don't need to attend a study or coaching course to pass, but many candidates choose to do so. The GMC doesn't offer courses and they do not endorse or monitor the quality of courses given by others. There are many course givers you can find, but the GMC doesn't offer courses and they do not endorse or monitor the quality of courses given by others. So a sample OSCE station. Okay, so this is how the scenario may resemble. You are in a mock consultation with a patient played by a role player who has been briefed about their condition. You are an FY2 doctor in a rheumatology unit. You are told that your patient, James Horton, aged 45, has been referred by his GP with pain in the right big toe. You are not given any other information. You must assess and manage the patient. You will be given 8 minutes to complete the scenario. Again, you are in a mock consultation with a patient played by a role player who has been briefed about their condition. You are an FY2 doctor in rheumatology unit. You are told that your patient James Horton, age 45, has been referred by his GP with pain in his right big toe. You are not given any other information. You must assess and manage the patient. You will be given 8 minutes to complete the scenario. This is how a scenario can look like. Okay, so what will the examiner be looking for? The examiner wants to see you demonstrating the behaviors, what we expect of a doctor. They will mark you against the 3 main domains we have mentioned earlier: data gathering, technical and assessment skills, clinical management skills, and interpersonal skills. This is what the examiner will be looking for. Okay. What will you need to demonstrate to pass? You need to find a history of acute recurrent monoarthritis. We are talking about the sample OSCE question we have mentioned earlier. You can find a history of acute recurrent monoarthritis which responds to non-steroidal anti-inflammatory drugs. Okay, this is need to demonstrate. The first thing you need to demonstrate to pass this station. You need to find the medical history of any medication, psoriasis or trauma. You need to find the medical history of any medication, psoriasis or trauma. You need to find out appropriate lifestyle history, such as alcohol, diet, sexual activity, sex. Okay, does alcohol affect this problem, this monoarthritis? Diet can affect, sexual activity can affect this problem. You need to make a diagnosis of possible gout. You need to give a diagnosis. You need to recommend appropriate management to your patient. You need to identify patient concerns and listen appropriately and display empathy to your patient. You need to listen to your patient and display empathy to your patient. You need to conduct the consultation fluently and professionally. Fluently and professionally. Okay, this is really important. You need to act fluently and professionally. Please do not hesitate and try to seem professional, try to seem confident. It's really important in your exam and in your real life situation as well. Additional information, you may be asked to complete a station which contains a prescribing element. You can prescribe a medication. You can prescribe a medication. So really important to be trained upon how to do so. Okay, the exam day. I know how stressful is the exam day and how you are getting worried about your exam day. But please never worry about your exam day if you are well trained if you are confident enough before going to the GMC building. So, what can you expect on the exam day? Okay, when you arrive, please bring the documents. Your documents will be checked and your photograph is taken. You will be given an ID badge, which you will need to wear throughout the exam. So your photograph will be taken and you will be given an ID badge, which you will need to wear throughout the exam. You will not need to take anything with you into the exam. Not even your own medical equipment. Everything you need will be provided. So please do not worry about bringing anything with you inside the exam room. Everything you need will be provided, so don't worry. So during the exam, you will find some scenarios you will have mannequins or other equipment. Others will use an actor to play the part of patient. During each of the exam stations, you will be observed by an examiner, either in person or via a remote camera. Your exam will not be recorded and examiners will not intervene except in very limited circumstances. Okay? So during each of the exam stations, you will be observed by an examiner, either in person or via a remote camera. Your exam will not be recorded and examiners will not intervene except in very limited circumstances. You cannot talk to other candidates or write down or copy any details about the exam while you are taking it. Okay, please do not talk to any of other candidates, write down or copy any details about the exam while you are taking it. You cannot bring books. Please, doctors, do not bring any books, mobile phones, or smartwatches into the exam. Okay, really important to keep this in your mind. So what should you bring with you in the exam day? Identification. You need to bring a proof of identification with you, ID. We accept any one of the following: the passport, the UK driving license, EU identity card. Those with refugee status may also provide a biometric residence permit. If you don't have one of the above, you can take the exam, but you will need to provide your identification document or evidence of a change of name later in the process. So most of the abroad doctors, they bring the passport with them, or can also bring a UK driving license or EU identity card. Really important to bring the proof of identity with you the exam day. You need also to bring with you the booking confirmation. Bring the booking confirmation that includes your GMC reference number. If the name on your ID is different from that on the booking confirmation from the GMC or the British Council, you must bring with you original evidence that you are the person named in that letter. We will accept a marriage certificate declaration from the awarding body which granted your primary medical qualification, stating that both names relate to you. So booking confirmation is really important together with your ID. So what is the dress code? Okay, so this is the dress as you would to work in a UK hospital ward or other clinical setting. This would normally mean bare to the elbow and no watches. Please never wear a watch inside the exam in the cubicle. And try to roll your sleeves up. Never use bracelets or rings. Male candidates would be expected to wear collared shirt with short or rolled sleeves and no tie. Please never bring a tie. Candidates should not wear jeans, shorts, or sandals. Okay, So please stick to those information. It's important that patients feel able to build relationships of trust and communication freely with their doctor. Some patients, for example, may find that a face veil worn by their doctor presents an obstacle to effective communication, so you must be prepared to respond to a patient's individual needs. Role players are told that they must make it clear if a candidate wearing a veil is unable to communicate effectively, and examiners are told that they should mark the candidate accordingly. So, exam results. This is one of the most important days in your life, and hope all the candidates get good, very good marks and pass their exam. So, how do you get your results? So, where do you get your results first? When your PLAB 2 results are available, they will send you an email to access your results in the My Tests section of GMC Online. Please be aware that we cannot give results by telephone, fax, or at our reception, the GMC is telling you. When do you get your results? Your results will be published within the 4 weeks after your test date. Within the 4 weeks after your test date. So you can get your results through the GMC Online under the My Tests section, or an email will be sent to you as well, but you cannot get your results through the telephone, fax, or at the reception of the GMC. When your results are published after 4 weeks or within the 4 weeks after your test date. Okay, so understanding your results. Quantitative feedback. You need to understand your results. You have quantitative feedback. They will tell you the marks you were awarded in each of the 3 marking domains for each station. As we've mentioned earlier, the 3 domains are the data gathering, the interpersonal skills, and the management part, together with a total for each domain across all 18 stations. Each domain carries the same marks, so you will be able to see in which domains you are stronger of the 3 domains. They will also tell you the score you achieved in each station. The score you achieved in each station and the score required to pass the station. So they will tell you the score you achieved in each station and the score required to pass the station. The score you achieved overall and the score required to pass the exam. Hope you all get the score that requires you to pass your exam. You do have another type of feedback, which is a qualitative feedback. When you have finished each station, the examiner will be able to indicate which of 10 preset feedback statements they consider apply most to you. The examiners must do this if their overall judgment is that you were unsatisfactory, but they will also be able to do so if they judged your performance as borderline satisfactory or good. You will be told which feedback statements were indicated as applying to you in each station. So you have 2 types of feedback, quantitative and qualitative feedback. Okay, so the 10 feedback statements we have talked about are consultation, issues, time, findings, examination, diagnosis, management, rapport, listening, language. Again, what are the 10 feedback statements you are gonna mark it against? So consultation, the issues, any issues raised, time, your time during the exam, how was you managing your time, findings you have found during your station, examination, diagnosis, management, rapport with the patient, listening to your patient, and language, your language, how fluent you are, your language to the patient. Okay, so is there a fixed pass mark for each station? No, the answer is no. Each station has a pass mark which uses the borderline regression scoring method. This means that the pass mark varies with the difficulty of the station and for each exam. So there is no fixed pass mark for each station. Does the examiner know the station pass mark? The answer also is no. The examiner doesn't know the pass mark when assessing the candidates. So how do we work out if candidates meet the required standard of the exam? Again, how do we work out if candidates meet the required standard of the exam? So we add up the pass mark for each of the 18 stations in the exam. We add the pass mark for each of the 18 stations of the exam. We then add one standard error of measurement. This creates the total score for the exam. You must meet or exceed the total score and also pass a minimum of 18 stations to achieve an overall pass. So you need to pass both things. One of them, or the first of them, is the score, the total score of the exam. You need to pass it to pass the exam, in addition to pass a minimum of 11 stations to achieve an overall exam. Okay, so we may change our standard setting procedures from time to time without notice. So as a part of our quality assurance procedures, we may also exclude individual stations from your results. When we do this, we will reduce the pass mark and the minimum number of stations needed to pass accordingly to ensure that you are not disadvantaged. Okay, to make it simpler, if there is a problem that can happen with one of the stations, for example, then this means that the pass mark may be reduced and one station can be cancelled. For example, if one station is excluded, the results will be calculated from 17 stations, not 18. Therefore, 10 stations would be required to pass the examination as well as meeting the pass mark. Again, for example, if one station is excluded, results will be calculated from 17 stations only. Therefore, 10 stations would be required to pass the examination as well as meeting the pass mark. So what do you do after the exam? What do you do after you pass the exam? When you pass the exam, you can apply for registration with a license to practice and hope you all pass your exam. Then you can apply for registration with license to practice. You should have your application for registration with a license to practice in the UK approved within 2 years of passing part 2 of the exam. This applies from the point you take part 2, not the date you get your results. If you have passed PLAB 2 more than 2 years ago, you will need to provide additional evidence of your knowledge and skills. Once you have submitted your application, we will contact you about to let you know exactly what is needed. Okay, so the GMC is telling you so after passing your exam. Okay, so what do you do after the exam if you fail? First thing, you need not to give up. You will sure pass the exam the next time with hard work and trying to minimize your mistakes after knowing them. So if you fail the exam, you can book to take the exam again, provided you meet all the requirements. You can attempt the exam a maximum of 4 times. 4 times. If you have failed the exam 4 times, you can apply for one final attempt. You will need to demonstrate evidence of additional learning over a 12-month period and make an application to us. So you have a maximum of 4 times, but if you failed the exam 4 times, you can apply for one final attempt. You will need to demonstrate evidence of additional learning over a 12-month period and make an application to us, to the GMC. So what do you do after the exam? How do you arrange for your results to be checked? You can email us if you want your results checked, or write to us at our Manchester office address within 28 days of receiving your results if you need your results to be checked. You will need to pay the current clerical check fee shown below. The request for clerical check of results for the PLAB 2 test is £47 from 1 April 2020. A clerical check of your results does not mean your exam will be remarked, and you will not get any additional feedback on your performance. It is a check to make sure your marks have been transcribed correctly. Again, it is a check to make sure your marks have been transcribed correctly. Okay, so are you eligible for an additional attempt? When can you apply for an additional attempt? To be eligible for an additional attempt for either PLAB 1 or 2, after your 4th attempt, there must be at least 12 months between your 4th attempt and requesting an additional attempt, as we have mentioned earlier. You should undertake further learning to improve your medical knowledge and clinical skills. You must have completed either 12 months clinical experience or clinical practice or a postgraduate qualification. So you should undertake further learning to improve your medical knowledge and clinical skills. You must have completed either 12 months of clinical practice or a postgraduate qualification. So when can you appeal your results? An appeal is a request for a review of a decision made by us, by the GMC, about your performance in an exam. If you have attempted any part of the exam, you have a right to appeal against the result if. What are the conditions that you can appeal for your results? First one is there is a clear evidence of irregularity in the conduct of the exam, including administrative error, which has adversely affected your performance. The second thing is there were exceptional circumstances for which clear documentary evidence must be provided, which adversely affected your performance. You are advised to submit details of any such circumstances as soon as possible after the examination. As soon as possible after the examination, you are advised to submit those details of any obligatory circumstances, usually within 3 working days, and not to wait until after you receive your results. Please put this in your mind. When can you appeal for your results? So, the GMC will not accept any appeal for other reasons, such as you consider that your efforts were undermarked, for example, or you didn't understand or was unaware of the exam procedures. You seek to question the exercise of professional or academic judgment. If you want to appeal the result of the exam, you must have clear evidence of a procedural irregularity which has adversely affected your performance. So those are the things to keep in your mind. The GMC will not accept an appeal in such reasons. Okay, so to summarize, what we have said today. So what is a PLAB 2 exam? How will you be tested? When and where can you take the PLAB 2? How do you book or cancel a place? What resources should you use? We have talked about a sample OSCE station given by the GMC website. What reasonable adjustments can we make? What can you accept in the exam day? Explore the assessment center using the VR. This you can find on the GMC website. How do you get your results? Understanding your results. What do you do after the exam? Are you eligible for an additional attempt? How do you appeal your results? So our reference is the gmcuk.org. So thank you so much, doctors who have attended my session today. It was a brief summary about what you can find in the PLAB 2 exam according to the GMC website. Hope everything was clear to you. Please, if you need any help or you have any question, please send me on the YouTube channel, and the Telegram link, or whatever you want, or the WhatsApp group. I will be more than happy to answer all of your questions. Thanks so much, doctors, and hope you all pass your exam from the first attempt. Thanks so much for your patience with me today, and best of luck. See you soon, all in the UK. Thanks so much.